Okay, so looking at the extrinsic muscle, the extensors mechanism, we're going to test the three muscles for the wrist. In testing the extensor carpi radialis brevis, I'm going to have the patient make a fist, and I'm going to apply with their wrist extended pressure over the third metacarpal. 1, 2, 3, relax. Then with their hand open and with their wrist extended, now for the extensor carpi radialis longus, place pressure over the second metacarpal. 1, 2, 3, and relax. And then the final one for the extensor carpi ulnaris, pressure over the fifth metacarpal, pulling towards me. 1, 2, 3, relax. For the fingers, the extrinsic muscles, looking at the extensor digitorum, I'm going to have the patient curl their fingertips and be able to show you so that I'd be able to put pressure, be able to really isolate out the extensor digitorum. I will now put pressure while their MCP joints are extended, pressure over the proximal phalanx, pressure down, 1, 2, 3, 1, 2, 3. Same for all four fingers. Okay. For the extensor, for the two extra extensor muscles, one for the index finger, one for the small finger, I'm going to test the extensor indice. I have the patient make a fist with their index finger extended. I'm going to place pressure just distal to the MCP joint. 1, 2, 3, relax. And then for the small finger, the same concept. Everybody flexed, small finger extended, pressure on the proximal phalanx, down. 1, 2, 3, relax. For the thumb, you have your extensor pollicis longus. I'm going to have the patient extend their thumb, and I'm going to apply pressure down on just distal to the IP joint. Pulling down. 1, 2, 3, relax. For the extensor pollicis brevis, to kind of knock out the EPL, I'll have the tip of the thumb bent. Their thumb is still extended at the MCP joint, and I'm going to put the pressure down just past the MCP joint. Down. 1, 2, 3, while they try to hold there. And then the final one for the thumb is the abductor pollicis longus, with their thumb radially, you can see, radially abducted, straight out. I'm going to place pressure on the distal end of the metacarpal to be able to apply and try to adduct the thumb. 1, 2, 3, relax.